joining us this morning. We would like to thank everyone for taking the time out of their Saturday to be a part of this first Critical Conversations in Minority Mental Health online web event. Very special thank you to Ms. Elena Schexnayder for setting this all up. She is a member of the NAMI Minority Mental Health Committee. So very special thank you to Elena for an awesome job that she has done with getting this set up. We are very grateful for our panelists who are joining us this morning, Ms. Regina Mobley, Pastor Terron Rodgers, and Aaron Rouse. And we have already muted everyone's Zoom feed so that we can hear the panelists clearly at the time that they are speaking and giving their information. Just so that everyone is aware, our speakers will have approximately 10 minutes each to discuss their topics of interest, and then we will be allotting for approximately 30 minutes for questions and answers afterwards. So we will stick pretty close to the time frame that has been allotted for today so that we give everyone the appropriate amount of time to address the topics.
Oh my God, every time you hit something, it goes back. What is going on?
We are overwhelmed by the outpouring of the responses for everyone, especially every participant that's joining us this morning. With that being said, we will not be able to address every question that is going to be submitted by the registrants, but we will, however, be responding to all of your questions and concerns by sending responses in a later time frame, and it will be just within a few upcoming days of this forum this morning. So please feel free, as always, to reach out to NAMI Coastal Virginia on their website at namicoastalvirginia.org. So again, the answers and other responses to questions will be sent out in the coming days. And I am your moderator this morning, Michelle Sampson. And at this time, I'm going to introduce our panelists. Today, we have Regina Mobley. Regina Mobley is a familiar face in Hampton Roads, someone who has been on the air broadcasting stories from the neighborhoods you live in and connecting with the community that she has loved for decades. In March of 2020,
I'm not hearing anyone.
In March of 2020, WAVY TV 10 welcomed Ms. Mobley to WAVY News 10, and then she is most watched as the anchor team member here in Hampton Roads, also with WVBT TV Fox 43. So we thank Ms. Mobley for joining us this morning. We also have Pastor Terron Rodgers. He is the executive pastor of discipleship and pastor of the Mount Light at Mount Lebanon Missionary Baptist Church, affectionately known as the Mount. The Mount is located in Chesapeake, Virginia, Yorktown, Virginia, Elizabeth City, North Carolina, and Charlotte, North Carolina. Pastor Rodgers served at Ebenezer Baptist Church in Virginia Beach as a senior pastor for 10 years. So we thank Pastor Rodgers for joining us this morning as well. We also have Aaron Rouse, who was born in Norfolk, Virginia and raised in Virginia Beach, Virginia. He attended First Colonial High School and graduated with a bachelor's degree in sociology from Virginia Polytechnic Institute and State University, also referred to as Virginia Tech. Mr. Rouse was drafted by the Green Bay Packers in 2007 during the NFL draft, and also played for the New York Giants and the Arizona Cardinals. And he is also a member of the Virginia Beach City Council. So again, we are thankful to Ms. Mobley, Mr. Rodgers, and Mr. Rouse for joining us this morning. All right, so we will go ahead and proceed with getting started with our questions. And Regina Mobley, we will start with you first. I'll read the first question, and then of course you will have the floor to respond.
Okay, thank you.
The first question, as the nation faces the unprecedented tragedies and challenges associated with the coronavirus pandemic, we would like to know what advice the mental health community can offer regarding daily mental health, self-awareness, and maintenance.
Actually, that was my question, Michelle.
Awesome.
I think Aaron Rouse and others will be able to relate to this. We spend a great deal of time working on the body, making sure the body is in good shape. But how much time do we spend daily making sure our minds are in good health? So I'd like to draw that parallel between physical health and mental health. This is something that we have to work on every single day. When I had my recent interview with WAVY TV 10, the news director asked me, Regina, what are some of the stories that you are most proud of? And my response was, I am most proud of the stories that describe the human condition. And so I want to take you back to the late 80s and 1990s in Hampton Roads when we were dealing with the crack cocaine epidemic. And I remember a story that took place in the city of Portsmouth. One night, the police responded to a school where something was going on the roof of that school that needed to be investigated. They went up on the roof of the school and found a little boy who was asleep on the roof of the school at night. And this boy was a student at this school. And they woke him up to ask, why are you asleep on the roof of this school? And he replied to the officer, Officer, this is the only place in my life where I feel safe. As it turns out, that little boy witnessed someone shoot and kill his mother. I know many of you remember the crack cocaine epidemic. It was devastating. I covered so many stories about individuals, families, and entire communities that were destroyed by the crack cocaine epidemic. I covered a number of stories where children had been killed. There was a little girl in Berkeley who heard what she thought was the sound of firecrackers. She peered from her window where she was shot in the head. A couple of days later, a little girl in Portsmouth was being watched by her mother's boyfriend who got into a dispute with another drug dealer. The boyfriend grabbed that little girl and held her to her chest and used her as a human shield. The rival drug dealer shot through the girl, shot and killed the girl. The drug dealer lived. A couple of days later, I attended the funeral of that second girl who was killed. And I turned to another reporter with tears in my eyes. And I said, Charlize, I can't do this anymore. I cannot cover the funeral of another child killed in Hampton Roads due to this senseless violence. I witnessed a lot of the senseless violence myself. I was within a few feet of gunfire in a couple of neighborhoods. And I remember an incident outside a community center in the Norview section of Norfolk, where the man who was leading this effort explained to me that many drug dealers would come to his facility at night. They had on body armor, and they would come to him in tears saying, I'm fearful that I'm going to be killed in this drug violence. I interviewed another young man in a public housing community of Norfolk, and he said to me, Miss Mobley, there are only two places in life for a man like me, jail and hell. I don't expect to see the age of 25. Over the years, the level of drug-related violence subsided, thankfully. And so I want to take you to about the year 2000. One Saturday afternoon, on a day much like today, I was in my home and there was a news bulletin that said, shelter in place. A gunman is on the loose near your home. Police are trying to track him down. Well, the police department did in fact call in the SWAT team, and they surrounded this young Black man who was holding a gun in a neighborhood. The police officers at that time said they were forced to shoot and kill this man. A day or so later, the Virginian Pilot wrote about that incident. And the reporter wrote, we've actually reported on this young man before. Way back in the 1980s or early 90s, this young man, as a boy, was found on the roof of a school in the city of Portsmouth.
Wow.
At that time, he told the police, "This is the only place in my life where I felt safe." Now, 35 years later, the stories remain untold on how many men, women, and children fell through the cracks because of mental health disorders that were never diagnosed or treated. This is the story that we need to tell today. Michelle.
Thank you, Regina, for the information that you just provided. I do also want to ask, how can the minority community prepare for the next pandemic? Regina, do you have any insight on how that can occur?
And so a lot of the evidence is showing that minorities, people who are older, 65 or so, and younger minorities are dying at a higher rate from COVID-19 because we have comorbidity factors. Even the young people in their 30s, they have high blood pressure, they have heart disease and obesity. Because of these factors, you are more likely to die from COVID-19. People in their 30s and people in my age group. So I pose the question, it's going to happen again. There will be another pandemic. How can we, as Black people, African Americans, prepare for the next pandemic? I do believe we need to work very hard every single day to improve our health, our fitness level, and our nutrition.
Thank you so much, Regina, for your responses to those questions. At this time, Pastor Rodgers, it's my understanding that you have a topic that you would like to discuss with all the registrants and other participants at this time. So if you're ready, I'll let you take it away.
Yes, ma'am. I have been given the task to talking about the stigma, awareness, and outreach in regards to mental health. I'll give us this little story about this young man who came to our church one Sunday, and he sat in the front of the church and he said that he had issues and that he needed to speak to somebody. Nobody there at the time was able to deal with his issues because he was really having a psychotic meltdown. He was having a breakdown at that time. And so when I came into the building, we began to talk, and I brought him into my office, and he just began to tell me about the voices and things that he was hearing, and that he really believed that he wanted to hurt himself. And so because of all of the training that we have received, we understand that even though we are a spiritual place where we deal with the spiritual being, the reality is we are mind, body, soul, and spirit. And so not only do we have to deal with his spiritual issues, the reality is there are some things that just can't be prayed away. There are some things, even though I believe the power of prayer, I believe that prayer changes things. I believe that we have the ability to go to God and God can move on our behalf. I also believe that there are moments when we need to really seek counseling from those who have been trained to do so. And so that day, because our bishop, Bishop Kim W. Brown, is a very forward-thinking man, and our Elder Valerie K. Brown, we have a side D on staff at the Mount Global Fellowship of Churches. And so at that time, I was able to call her, and she was able to come down to my office, and we were able to sit with this individual and deal with his mental health issues. And so the reality is, when you don't have the ability to deal with the whole person, things can go in a very, very wrong way. And so because we've been trained in those areas to ask the right questions, hey, do you feel like you want to hurt yourself? All those kind of things, and to be able to report those kind of things, we were able to help that individual on that day. So in regards to what I do as a pastor, we have to deal with people on a daily basis in all of their problems. And one of the problems with us as an African-American race is that we don't want the stigma of being called crazy. We don't want to have anybody thinking that there is something mentally wrong with us, when the reality is all of us deal with issues, and all of us don't have the coping mechanisms in our being to be able to deal with every situation. And so I've learned for myself that there are times when I truly need somebody to talk to. And there were moments in my life when I was dealing with situations, not only from a pastoral perspective, but as a husband, as a father, as a Black man in America. You know, I deal with the fact that when I'm riding down the street and the police officer gets behind me, I too get anxiety about that. And so there are things that I deal with as a human being, as a pastor, as a Black man in this country, that I truly need to be able to deal with for myself. And so I have been to a psychiatrist and sat down on the couch and literally had to throw up about what I was going through. And so I have learned that in helping the African-American community to be able to deal with this stigma, I am very transparent from the pulpit in regards to how I deal with my issues. I am a praying man, I'm a man of faith, but there are also times, again, when I do need to speak to somebody on that level that can really help me to deal with what I am dealing with mentally. And so I make it clear to my congregation that even though I am a spiritual being, there are moments when I need to sit down with somebody and talk about my issues. So for me, I think that helping people to see through my transparency that even as a pastor, I can deal with some stuff that I can't handle on my own. I think it breaks down the barriers for many other African-American men and women to be able to say, you know what, it's not so bad being able to talk to somebody about the issues that I'm experiencing, whether it be depression, whether it be some undiagnosed issues that a person is having. Because the bottom line is sometimes we try to demonize everything that a person has had, every situation a person is having. They can be hearing voices, and the spiritual community will say that it's demons. I don't disregard that, but I also believe that psychologically that there are times when we need not only prayer, but we need medication. Amen, somebody. Amen. And so for me as a pastor, part of dealing with helping others to understand that having problems is not something that we should shy away from, or think that the fact that somebody may call us crazy, keeps us from being able to go and seek the attention and the help that we need. So for me as a pastor, I've been pastoring for 14 years. I deal with everything from divorce, everything from mental substance abuse, everything from people dealing with their sexuality. You name it, I deal with it as a pastor. And I'll be lying to you if I say to you that there are not days when I take all of that home with me, and everything that I've had to deal with the people in my congregation is not resting on me with a heavy weight. Because I want all of our people to be made whole. I want all of our people to be able to live a life and live it more abundantly as God has desired for us. And so sometimes when what I say can't help them to move into that area, I just want to make sure that I'm able to show them a way that they can be made whole. And so the fact that we have a PsyD on campus that we're able to push people to when we can't deal with it, that's another thing as a pastor. I have to recognize my limitations, my boundaries, and what I can do to help an individual. There are some places in an individual's life that me as a pastor alone cannot help that person. And I have to be able to refer that person to the place where they can receive the help that they need. And so for me, helping to take away the stigma of being called crazy or not wanting to go seek counsel, just being transparent with the folk that I lead in my congregation has helped a great many people to be able to find out and find and seek the help that they need and be able to refer them to that help. So I hope that helped answer the question. I take major notes. I write down manuscripts so that I won't miss things that I want to say. So I got a whole lot more I want to say, but in that 10 minutes, I'm going to defer. So back to you, Michelle.
Well, thank you, Pastor Rodgers. I actually, we have about 2 more minutes to have a little bit more of a discussion on stigma. We did have a question submitted that I did want to ask you. And that question is, how do we get more churches or preachers on board to talk about mental health and help dispel the stigma around getting help?
I think it's clearly based on us being transparent, because most people want to look at pastors as a super being, a person that never has any problems. That's the person that you go to when you need help. Bringing things to the forefront in terms of, we go through things too. Pastors deal with things too. Pastors deal with problems in their marriage. Pastors have children that go through issues. Pastors have children. My daughter right now is in her room packing to go back to Elizabeth City State University because she is ready to go back to school. And the bottom line is, I deal with that anxiety about, is my daughter going to be safe? Is it the time for her to really go back to school during this pandemic? And she has 30 more days. She doesn't have to be back to campus until August 8th. So I'll call my girl, hey, I need to talk to you because am I being selfish? Am I being petty about the way that I feel? And so I think that just being transparent and just helping other pastors to understand, you don't have to be this superhuman person, because what we're doing is causing people to miss the help that they could truly get by making them think that you can handle it all on your own. And even as a pastor, I can't handle everything on my own. There are times when I have to go and sit in front of my pastor, Bishop Kim Brown, and just talk to him about issues I'm having as a man. And then there are times when I have to go and talk to Dr. Otay Stacy Scott about my issues that I'm having with my sanity. And so, sometimes golf helps me when I can go out and hit that ball and put names and faces on that ball and smack it as hard as I can. There are times when I just need to go and talk to her and say, listen, I need to get another perspective on how I'm feeling. So I think that speaking to pastors and helping other pastors to understand their transparency is truly the key to helping others understand that they can go and get help and not be considered crazy.
Well, Pastor Rodgers, thank you so much for the information that you just shared. It is definitely helpful to know, as you shared, about what your Bishop Kim Brown has done to help prepare the leadership of the Mount to know what to do to point people in the right direction when they are faced with these questions or challenges. So it is definitely very helpful to know that more pastors and clergy members alike are doing more to help navigate this process. So again, thank you. And now we will go to Councilman Rouse and start with your questions. So I want to ask, how do we continue to provide a safe space for sharing about mental and emotional struggles amidst social distancing and fight for justice?
Wow.
I know that's a mouthful, Councilman.
Yes.
I will repeat it if you need me to.
Yes. Good morning to everyone. Once again, thank you for having me on. I think in order to provide that safe space so we can talk about the issues that are that we have and concerns that we have within our community, we got to utilize the tools that are available today, and that's technology. What we're doing right now, we're having a Zoom session with almost 100 people on there, and we're having a conversation so we can try to acknowledge the issues, the problems we have, so we can get to the solutions. I think in not only in the Black community, but just in America, America's psychology itself has we never did a self-assessment on really the current state of where we are, right? And the issues that we face as a country. And that goes all the way back to, slavery and the founding of America, the Civil War, the Reconstruction, Jim Crow, redlining, GI bills, all of these issues that, predominantly kept minorities and African Americans in a situation that was basically second class, African Americans deal with. And so you get to a point where all that frustration and years and decades of frustration builds up and it comes through. And a lot of times it's looked at as a mental health issue, when really as humans, there's only so much everyone can take, right? And so I think as a country, we need to understand the psychology of America and on both sides where African Americans where they were free, but not necessarily had the resources and the advantages they needed to become first-class citizens. And also the psychology of white America, understanding that, you know, African Americans asking for equality is not just we're setting them free, it's about also equity, bringing them on par to be able to thrive and be first-class citizens. So I think there's a lot of there's a lot of understanding that needs to go on, but I think it starts with the psychology that America is built on.
Okay, thank you. And I'm going to continue with you, Councilman Rouse, with this next question. How can local municipalities aid in making sure that the proper mental health services are accessible to their community members?
Well, I think it was Frederick Douglass that said, it is easier to build strong children than to repair broken men. Mm-hmm. And so I say that because I grew up in a single parent household. My mother raised 4 of us by herself, and my father is currently incarcerated. He's been in jail for quite some time now. And I'm originally from the St. Paul's Quadrant in Norfolk, Virginia, Young's Park. I think it goes by the name of Young Terrace today. Mm-hmm. And all I saw within my community were people who looked like me, spoke like me, and I never saw those elected officials. I never saw those elected officials who make the decision about how the allocation of resources really can help a community thrive, or keep a community disadvantaged. When I moved to the historic C-Tech community in Virginia Beach, in a community called Friendship Village, once again, I never saw the elected officials in my community. I did see them sometimes at rallies when the election season was around and they wanted to vote. That's when I saw them. So the communication has to start with our youth. It has to start going into those communities that don't have the direct access to the municipalities to understand what's really available, what resources are available to not only deal with mental health issues, but housing, education, business, all of these issues that affect someone's mental stability. And so really, I think it's important for elected officials to get out of City Hall and get into their communities, you know, start actually serving the people and meeting them where they are. And that way they can better communicate to the people what's really available, what resources are available. And in return, you will build that trust up and faith up within the government that says, listen, we have your back. We understand what you're going to. We can relate to your problems. And so that would be the first step, is to get out of City Hall and get into the communities, all the communities.
And thank you for that insight. I do have an additional question for you, Councilman Rouse. And that question is, what is a key element missing in providing mental health services to the minority community?
I think one of the key, issues of providing services for minorities is minorities need to feel like you actually care about them. You know, as a young man, like I said, who grew up in a single parent household, I wish there were times where there was, you know, a mental health professional who looked like me, who I felt comfortable enough to say, hey, I'm facing these issues, and do you understand these issues that I'm facing? And they're not necessarily dismissed. I think for a lot of times for those mental health professionals, they have such big hearts, and they go into communities of color and they try to get, the minority communities to talk to them, but not necessarily understanding, not even knowing where to begin and getting them to open their mouths. And I think a large part of that is it's a certain level of distrust minorities have when someone wants to ask them about their mental health. Because if you can't understand the plight that I'm going through, that I've been through, the pressures that society has placed upon my shoulders, why could you understand what I'm going through? You know, I think a lot of times, mental health, people look at it as just really a health issue, and they don't necessarily look at what causes the mental instability, the stresses of society, the implicit biases that goes around, the unserved and underserved communities you know, not being able to get a job, to be able to work, not being able to, for certain policies, for African-American males, not being able to live with your family because of Section 8 housing rules and things of that nature. Those are so many, you know, policies, issues that affect someone's, and so many issues of this society that affect someone's mental condition, that a lot of time is not necessarily ingrained or personal. It comes from external pressure that can create someone's instability.
Thank you so much, Councilman Rouse, for all of the feedback you provided for the questions. Before we go into opening up for other questions to be asked, I want to go back to Regina Mobley. And Regina, I do have a question that I want to pose to you. And that question is, what role do you think the media plays in adding and or decreasing stigma about mental health?
We typically do not cover suicides in the news media. However, over the last couple of decades, newsrooms across America are adjusting those policies because there are lessons that can be learned when we investigate what was going on in a person's life and examine some of the failures that have taken place over the years. In recent years, we've spent a lot of time talking about suicides involving celebrities. And I think because the media is now discussing what has happened in the lives of some celebrities, I think that you will see in the future more coverage when these deaths take place in our communities. One of the things that I was looking into some years ago in dealing with crime in our neighborhoods is PTSD, post-traumatic stress disorder. And this is something the social science community has been looking into. When young people grow up with gunfire, crime, violence, bloodshed, they have PTSD, along with many of the investigators who have dealt with these cases. And so Aaron alluded to this, the climate that takes place in our communities. Some of our children, yes, they have PTSD. And this is something that the community and the media can address. Many years ago, I started looking into the rate of suicide among Black men. And in the 80s and 90s, they started to track an increase in suicide that was parallel to the street violence that we see every day. So I think that the media needs to take a closer look at not just what happened, but why did it happen? Why did this young man who was on the roof of a school in Portsmouth, what happened in his life along the way? Was there any help provided to him? And we need to follow up on these cases and follow up with the families and follow up with the mental health community to make sure that there are some safety nets in place for our children.
Thank you so much, Regina. All of the feedback that the panelists gave was very helpful. So again, we want to thank Regina, Pastor Rodgers, and Aaron Rouse. So at this time, we're going to open the floor up for questions from the participants. So we ask that you please use the raise the hand feature to indicate that you do have a question. And once you do so, we will unmute you and you will be able to ask your question and it will be addressed at that time.
This is Dr. Ivy J. Warren. Hello, everybody. I was trying to find an icon, and for the sake of time, I have a quick question that either the panelists can answer. What do you think are some of the strategies as well as interventions that you think will be instrumental in dealing with minority mental health issues? Because a lot of times people think that there's no quick fix, there's nothing that can be done to assist them in overcoming having these feelings. So what are some of the best practices or strategies or interventions that you think could be implemented to get past their feeling this way?
I would say, if I can, I would think our best practice would be, we have to talk about it more. And I think it's up to those who are seen as community leaders, who are seen as people in the communities look up to, in the minority communities. You have to be able to talk about it more, but provide those places where we can meet and discuss those things. I think a lot of times things gets lost in translation on social media. I think we all can agree to that. So I think we have to get back to the human interaction of, hey, I see you, I've been there, or I may be going through the same thing, but connecting to each other. And so I would say that getting together more, and it's up to those members within a community who the people look up to start that and to help that.
Thank you.
Thank you so much. Okay, Heather, you're next.
Thank you. It's really wonderful to be with you all, and I appreciate the opportunity to participate. This really dovetails with the notion of PTSD. I am a peer recovery specialist I live in Forest, sort of South Central Virginia, but I volunteer at an organization called On Our Own in Charlottesville. So we're a peer organization, and many people are trained as peer recovery specialists. So I'm in recovery for mental health myself, and I'm just wondering to what extent peer recovery specialists would be viewed as being a way to help reduce stigma, and also the idea of trauma-informed care. I am trying to get away from, using my diagnosis to describe myself and wanting to talk about my history and maybe what has led to my own stressors in my own mental health challenge. So I just wanted to share that and also ask about trauma-informed care and peer recovery specialists. Thank you.
Do we have someone that would like to provide some feedback to Heather's question? One of the panelists, if possible.
I can offer just from my thoughts. First of all, there's not enough being done in our society for mental health. There's much more that needs to be done in regards to more resources, and especially for the minority community. I don't believe that there are enough resources for those who can't afford the help that they need, as well as the misconception about PTSD. PTSD used to be a military problem. That used to be a problem that only people that were in the service or had been in war conditions, only those kind of people were the ones who were able to say, I have PTSD. But just like Regina Mobley stated, this young man that was on top of that school, he had a traumatic situation in his life, and possibly his entire life, that led him to his demise. And so post-traumatic stress syndrome is something that I think all of us have had some traumatic moments in our lives, and we're able to get the help that we needed, but everybody has not been afforded that opportunity. So I think that we need to do more in our society. I think that there should be more options available for people who need the help as well. There needs to be more education on how to identify those people who have those needs. I think that you can sit and have a conversation with a person, but because we haven't been trained on how to identify those issues, we can't see what needs to be done and the help that they need. And so peer groups, peer support can be a great resource as well. And that's something that you are already involved in. And so we have this gentleman at our church, Bernard Hines, who is a comedian who is also being treated for PTSD. But this guy, he approaches his PTSD from a whole different perspective, and he makes comedy out of it, but he draws people in with it, and they see that there's no need to be afraid of being diagnosed with PTSD. It's just the reality of life. You've been through certain things in your life and you have to deal with them. And so I think that gives people the opportunity or the open door to be able to express the situation and the problems that they're having. Hopefully that helps some.
Thank you so much, Pastor Rodgers. We also have a question from Keisha Blair. Keisha, you can go ahead with your question at this time.
Good morning, everyone. So I don't have a question. First, I want to say thank you to Mr. Wiley for the invite, but I just want to share that I'm a military psychiatrist, so what I'm about to say is strictly my views only. It's not the military's at all. But when I think about mental health, I tell my patients, mental health is about change. If you don't want to change, then you're not going to get anything out of seeking mental health care. And so people need to be mindful of that when they're saying, okay, I want mental health, and they have to understand what is it they're looking for to change or what they want to work on. The big thing I see that I don't think society talks about enough with anybody, and Pastor Terron alluded to it as well as Ms. Mobley, is trauma. The overwhelming majority of my patients have experienced childhood trauma. So there's significant deficits that are going to happen when someone is being traumatized as a child. And the most common form of abuse that I see them experience is sexual abuse. And so sadly, when we're a child, we are growing up, we're formulating, we learn how to build relationships, trust mom and dad, trust adults to keep us safe. And that's not happening when you're being violated as a child. And this is what they grow up with and formulate as they become young adults. And so I think it's important that we have to make sure we protect our children. Like I get annoyed, people say we have to protect our daughters. No, we have to protect our sons as well. We have to protect our children, right? And as we all know or should know, that when we're talking about pedophiles, it's most commonly family members or people in your circle of trust. So I think we have to be more cognizant of that because that's significant, and I think we don't talk about it enough. And so I just want people, when we're thinking about the need for mental health care and going back to what was said, because it's my thing, we have to ask ourselves why. Why do we need this? Why do we need this mental health care? Why do we need this medication? And I often tell my patients, when they're saying they want medication, I say, okay, what are you looking for medication to do? Right? Because medication doesn't address the underlying issue. To address the underlying issue, you have to change. So what is it they want to work on? Yes, medication can be an additional benefit, and there's definitely a lot of my patients that can benefit. And when I say that, I'm not talking about the patients that are psychotic or manic. Those people definitely need medication. I'm talking people that, maybe saying they have trouble, they're unhappy in their marriage, or they don't like their workplace. Like medication is not going to do stuff like that. Or they're still struggling with what happened to them in the past. And so that they don't, you educate them that there are different types of therapies too. So when people think therapy, the therapist needs to know, okay, what am I treating? So that's kind of what I want to share. I think to me, the big thing that we're missing when we talk about mental health care is no one's asking why. Why do you need it? And the why, in my experience, is typically coming from childhood, what happened there. And I think that the panelists essentially said that too when they talk about the emotional abuse, the gun violence and stuff, but no one's talking about the sexual abuse, and the amount of sexual abuse that's happening out there is atrocious. We have to start paying attention to that. Parents have to start believing their children when they mention that and not dismissing it, not being okay with it because it's a family member or it's the new boyfriend who's paying the bills. These things have long-lasting effects. That's all I wanted to share.
I have a question for the doctor.
Yes, ma'am.
I did a story on this years ago, and I'm just wondering if the statistics are still the same. 1 in 3 girls is sexually abused. 1 in 5 boys is sexually abused.
So I don't know it offhand, but I have a paper that I can look at because I was keeping track of that, but it's still very high. And even the numbers that we hear, we still know that it's underreported, so we expect it to be higher. I forget what website I was looking at because I had actually started doing Wisdom Wednesdays on my social media page, just because of this reason, because I just don't think we talk about, childhood sexual abuse enough. So I can't quote that for sure, but because I got my information from a website as well, but it's still significantly high. And like when I think about my patient panel, the overwhelming majority of my patients were abused in childhood. The overwhelming, it's really sad. And like I said, from family members, it's really sad.
Keisha, thank you for all of the feedback that you just provided regarding the information that you presented and the response to Regina's question as well. I do want to ask a question to the panelists in general. To the panelists, how are we able to better assist in our communities using RAP around services which promote mental health or mental wellness?
Very good question. Go ahead, Pastor.
No, I was just going to say, I think in order to really provide the services of mental health in our minority communities, I think it's very important that we understand or somewhat try to understand the conscience of African Americans in America. And I go back to this as a whole because, and I think Du Bois put it best, and I want to read a quote that he has. One never feels his two-ness, an American and a Negro. Two souls, two thoughts, two unreconciled strivings, two warring ideals in one dark body, whose strength alone keeps it from being torn asunder. And so I think when you understand, and we all understand as African Americans, that we gotta do everything. We gotta dot all the I's, cross every T's. We gotta make sure we don't get out of line. We gotta run a little bit faster, jump a little higher. That this America never lets you forget about the color of your skin. And so when you have these conversations about mental health, or even have these conversations with your friends who are white or of another race, they say, why does everything got to be about race? Well, it's like, well, we are, every step we take outside the door, we are made to never forget what color we are, right? Or what race we are. And so that mental health, a lot of African Americans don't deal with that as well as some others, right? You have some people who break down, who have nervous breakdowns, or you couple that with the childhood trauma, or you couple that with maybe not getting a job or a promotion at work, and you was more than qualified, and you've been at the same position for 5-6 years with no pathway of getting promoted, or you don't get a loan, or your interest rates on that loan is too high. The pressures of this society can make one lose it. And so I think when we talk about what resources are available, I think this has to be, so much resources has to be allocated towards mental health, because it's a condition that we all, black and white and whatever race you are, go through every single day you step outside the door. And so as a local elected official, I always look at, okay, how can we try to limit or mitigate the social impact of a society, right? In doing so, I try to help my colleagues understand the psychology of institutionalized racism that perpetuates the social structures of society. So when we get to mental health, we say, well, mental health maybe not be as important as economic development. Well, I go back and say, well, if we don't put money into mental health, there will be no economic development, because large corporations will not want to come to Virginia Beach or any other place that's not as diverse, that understands their community as well and how to relate and what they're looking for. See, the health of your community or society will determine how strong your city or government or structure will be. And so that's why it's important that we allocate the resources toward mental health, but also physical fitness as well. So sorry, I didn't mean to go too long, but
no,
just wanted
if I can add to what City Councilman Rouse just spoke of. I think that also seeing others who look like us. I think the problem is in many ways that, you know, when we don't see people that look like us in those positions, I think that exposure is key. That, you know, I can see somebody that looks like me that is able to reach that mark. So I think that that is a critical part of being able to grow as well. But I did my research on the RAP thing because I just didn't understand. I didn't know what it was until I looked it up, and I found that RAP means Wellness Recovery Action Plan, and it talks about is designed for high-risk children and adolescents with the most complex needs. These services aim to keep children and their families through individualized services developed in a family-centered team planning process. I think that in regards to that, I have an autistic niece. and one of the things that has been difficult for my brother and his wife is helping, being able to help their daughter is not having the resources available to them. They've had to travel as far as Richmond to try and get her the help that she needs. And so I think that when it comes to that Wellness Recovery Action Plan, being able to go through some steps to be able to help your child, I think that more resources, again, need to be available for people who have children who have problems. And you can't develop a plan if you don't acknowledge that, there's a disparity in the entire system. I think that goes back to what Mr. Rouse was just talking about. The reality is we don't have the resources, and when it comes to the African-American community getting those resources, I think that there's a great disparity that keeps us from reaching that level just because of the color of our skin. So my niece is 20 years old now and still not at the level that you would want to see a 20-year-old young lady at because of the lack or the ability or the lack of ability for my brother and my sister, my sister-in-law to find resources for my niece. So for me, a wellness, recovery, action, and plan, that sounds good on paper. But when you show up in the office, you know, will you be able to get that plan to help with your loved one to get the resources that they need? So for me, I think a lot of these action plans, a lot of these things that have been put in place, they need to be culturally sensitive. And so for me, I think that that is a direction that we really need to go in our society to make sure that we're meeting the needs of all people and not just some.
And Pastor Rodgers, I want to thank you for taking the time to bring some clarification to what RAP stands for. And just so everyone knows, if you need more information about RAP, you can contact me at the Office of Consumer and Family Affairs, which is a part of the Virginia Beach Department of Human Services Behavioral Health Division. And the contact number is 385-0802. And feel free to give me a call and I can provide you with more information on RAP if that is needed. So again, thank you, Pastor Rodgers, for bringing some clarification to what RAP stands for. That is greatly appreciated. So at this time, we're coming to the end of today's discussion. I just want to remind everyone again that if you have more questions regarding mental illness, you can definitely feel free to reach out to NAMI, and their website again is namicoastalvirginia.org. And also all of the questions that were posed will be answered in the upcoming days and sent out via email to all of you who registered. Pastor Rodgers, I see your hand. Did you want to add one more thing?
Well, I want to know if we will be having another conversation like this, because I really wanted to deal with the policing and mental wellness. Because we all have seen on social media and things of that nature where police go to deal with people who have mental illness, and it don't always turn out well because they don't know how to handle situations like that. So I was really hoping that we would be able to have a conversation about that. So I see we've run out of time today, but hopefully in the future, we'll be able to have that conversation as well.
And I would like to add, Dr. Blair, thank you so much for raising the issue of sexual abuse, but we also need to talk about drug abuse. Many of the stories that I have covered over the years involving violence involve substance abuse, the sale of drugs, the use of drugs, etc. so much treasure destroyed by drugs. But keep in mind, 3 of the brightest, most significant personalities in Black history, Michael Jackson, Prince, and Whitney Houston, also died from substance abuse.
Yes, ma'am. And Ms. Mobley, I have found my paperwork because I had myself in. The answer to your question is it's 1 in 4 girls and 1 in 6 boys will be sexually abused before they turn 18 years old.
Wow.
Thank you so much for finding that that data for us. That is great. Councilman Rouse, do you have anything that you would like to add? Pastor Rouse and Regina just weighed in. Any comments from you at this time?
We need to just show love, show our kids love.
Yeah.
The men living on the streets of Hampton Roads, someone needs to show them love as well. And when I'm doing interviews with young men and women on the streets, even the drug dealers, I show them love, and they seem to appreciate that.
Thank you. Councilman Rouse?
I would think, I think we have a lot of, it's a very complex issue. We talk about mental health. As a social scientist, myself, I try to look at it almost from a holistic view, but I understand as well that for African Americans, we shouldn't walk away feeling like there's a shortfall within ourselves or within our race. When the shortfalls come from our society, and so just looking at it from a holistic point of view, I know we have some officers and stuff as well. I wish we could have got to policing, but I also just wanted to comment. As a society, we've placed too much on the shoulders of our first responders and our police officers, and not enough on our elected officials. This whole notion about defund the police, I mean, I don't know, that was somebody just created a talking point, when the focus should really be about how do we solve disparities in business? How do we solve the issues in education and mental health? How do we find affordable housing and transportation? All the issues that will mitigate the interaction between those who may have mental instability with our police officers. That's not to say that there aren't things we can improve within policing in America. I think we understand the history of that, and it goes all the way back to the fugitive slave laws. But just saying that we have to take more accountability as a society as a whole, and really trying to move us forward. And so this is a great start to the conversation. I wish we can go on a lot longer, but I'm looking forward to joining again.
Yes, well, we definitely will schedule a follow-up call to address issues such as police and substance use. So that will be something that will be coming forth in the near future. So again, I want to thank everyone for participating today. This was an awesome initial event, so it was very exciting. And to our panelists, Regina Mobley, Councilman Rouse, and Pastor Rodgers, thank you for answering the questions and all the insight provided. And I would like to thank Courtney Boone, Jen Williams, Sarah Corrado for giving me the opportunity to serve as your moderator today. It was definitely a pleasure. And again, a special thanks to Elena for putting this all together. So we will see each other in the very near future, I'm very sure. But I hope that everyone enjoyed today's event, and we hope that you have an awesome Saturday and remainder of your weekend. Thank you again, everyone.
Thank you, Michelle.
You're welcome. Thanks.
Thank you, Michelle. Excellent job.
Thank you, Michelle. Thank you all for having me.
Thank you. This is awesome.
Looking forward to a future event.
Thank you, City Councilman Rouse, and thank you, Regina Mobley. Thank you all.
You guys are amazing.
Thank you, Pastor, Councilman, and Regina.